Diabetic patients are exposed to the risk of developing food complications in the form of ulcerations, infection, and deep tissue damage. Diabetic foot conditions are often associated with neurological abnormalities and various degrees of peripheral vascular disease in the lower limbs. The prevalence of foot ulcerations in patients with diabetes have been reported as high as 10%. And the main risk factors beside the type 2 diabetes are older age, pre-existing neuropathy, reduced joint mobility, and increased foot pressures. The diabetic foot is a complex, multifactorial condition requiring a multidisciplinary approach. And recently, the Vascular Society has developed a comprehensive classification to address the risks, stratification, prognosis, and treatment options. This is also known as Wi-Fi classification. And the acronym Wi-Fi stands for extension of the wound, ischemia or impaired circulation, and foot infection. Diabetic foot ulcerations must be dealt as a medical and surgical emergency due to the impending risk of a rapidly evolving bloodstream infection, also known as sepsis, and the risk of limb loss, and the requirement of minor or major amputations. Diabetic foot conditions may have a significant impact on the overall quality of your life, a physical, psychological, and a social burden, so it is paramount to assess and restore the adequate blood perfusion, and that may require endovascular treatment or bypass surgery, but also to tackle the infections with strong antibiotics, to control the level of your blood sugars and your diabetes, and to implement a holistic wound care strategy. This ultimately requires a multidisciplinary joint effort involving the vascular surgeon, the specialist podiatrist, and the diabetes and infectious disease doctors. My colleague Sarah Watts is a top specialist podiatrist and a key member of our multidisciplinary foot health clinic. So let's hear from Sarah about diabetic foot care.
Our biggest aim is prevention and early diagnosis. Here are 5 top tips to keep your feet healthy and how to look after your feet. Look at your feet daily, checking for any trauma, blisters, tissue damage with bleeding or discharge, or any marks that you might not be aware of due to lack of feeling in your feet, also known as diabetic neuropathy. If you can't reach and see your feet, ask a relative or use a wardrobe mirror by elevating your foot, or a handheld mirror that you can put on the floor to ensure that there are no traumas on the bottom of your foot. Don't walk around barefooted. Always wear clean cotton socks every morning and look after your toenails. Check shoes fit well and with suitable fastening. Check for foreign objects such as stones, nails. Old shoes sometimes may have damaged lining or stitching that put extra pressures to the areas. Never be tempted to cut any hard skin or corns with the blade, and never use medicated corn plasters. If there is any break or wound in the skin, clean and cover with a dry dressing and contact your GP for urgent referral to podiatry and, if necessary, to your vascular surgeon. We provide a weekly acute foot health wound clinic. This is a multidisciplinary service with specialist podiatrists, diabetes and vascular consultants. If you think you have an infected wound in your foot, you feel unwell and your GP is not available, you can call 111 or attend minor injuries or A&E. These are the signs that indicate you might have a foot infection. Open wounds that are bleeding or weeping, if your foot or leg is hot, red, swollen, if the wound is smelly, if you feel generally unwell with shivery and flu-like symptoms.
Thank you, Sarah, for your expertise. If you have any concerns or questions about your foot health, please get in touch with our team to book a clinic or visit our website for further information. Thank you.